Green light, go. All right, hello everybody. We're going to be talking about how to perform a sports medicine or orthopedic evaluation of the forelimb. And this can be really challenging for people because trying to differentiate when you have a dog that has a performance-related issue, a lameness in the forelimb, sometimes it's hard enough to figure out if it's left or right, but then to try to isolate the exact area, especially with some of these more challenging soft tissue injuries, can be a bit tricky. So I'm going to guide you through sort of an assessment of how I look at the forelimb. Again, it doesn't matter if you start top to bottom or bottom to top, as long as you get into a systematic approach that's consistent for you. So the first thing we'll do is I'm going to start down here at this is Enzo, he's my border collie, and we're going to start down here distally, and especially with some of these dogs that are really active, always pay attention to their toes and their digits, because sometimes they'll just have a subluxated or a digit that's jammed, P1, 2, or 3. You want to make sure there's no laxity or sensitivity there. As you work your way up, you'll get to the sesamoids, Rottweilers, Greyhounds, certain breeds we see sesamoid disease more commonly. Get to the antebrachial carpal joint, a nice little recession here where you can feel for any swelling. If we have a dog that has carpal injury, autoimmune disease, tick-borne disease, you may feel some effusion in this location. Make sure you palpate for your carpal laxity through range of motion. On the underside, a very big important support structure called the flexor carpi ulnaris tendon, very common injury that we see strained if these dogs jump out of the car, jump off of something high, or repetitively do a lot of jumps. So we're going to stress that and put that through range of motion. Work our way up to the elbow, okay? So to put the elbow through range of motion, we should be able to go into a deep flexion, nice extension. It should be smooth and crisp with no snap, crackle, pop. If we feel a snap, crackle, pop, that's okay as long as it's not painful, but we should be able to go up into a deep flexion and range of motion, whether we're a border collie, a chihuahua, or a Great Dane, 35 degrees flexion is what we're shooting for, okay? Now, if we're talking about trying to differentiate the elbow from the shoulder, which so many times can be challenging for people, one thing I want to make sure we do is learn how to palpate the medial compartment of the elbow. So you're going to feel the inside where the epicondyle would be come down just inside of that distal, and it's right where the coronoid would be. And we're just going to palpate that, supinate, pronate, go into some nice deep range of motions as you're doing that to feel if there's any sensitivity in the medial compartment of the elbow. Let's work our way up. We're going to go up the forelimb, no signs of panosteitis, long bone pain. Now for the shoulder, the problem is I see too many times people actually trying to put the full limb through range of motion, and what happens there is you're moving the entire scapula thoracic. So it's extremely important that you isolate the scapula from the rest of the bone, the humerus, so that we're looking at just the scapulothoracic joint. So we're going to go ahead, basically stabilize the scapula. Now come behind the elbow, do your nice full range of motion into extension. Okay, test your teres. If we had OCD, border collie, things like that, we may see some sensitivity. Bring the shoulder up now into a deep flexion. This is isolating your supraspinatus. Now while you're here, let's bring that elbow into a nice extension. This is your bicep stretch, so it's a really nice isolation of your biceps. We of course can fall to the medial compartment of the shoulder to feel the biceps tendon as well and engage that biceps again as we're just kind of strumming that or palpating it. And then the last thing we want to feel is the medial shoulder. This is going to be your subscap, your MGL, your labrum, your capsule. Once again, localize the acromion process, lock that out if you would, behind the elbow, full extension. Now add your abduction, and you can see how this just comes to a nice, smooth, crisp end feel, okay? So you can see it doesn't go any further. There's no spasm, there's no discomfort, and we can actually then go ahead and test that, run your goniometer down the limb, elbow extension, shoulder extension, and put this through a nice abduction, okay? And Enzo's joint is right around 22 to 24 degrees. Good job, buddy. And so that is our forelimb palpation. One thing that can be tricky for people though, so let me walk you through this. I'm doing my full extensions, or I'm doing my bicep stretch and I'm getting sensitivity. Is that truly related to the shoulder, or is it related to the elbow? Because we have coronoid disease in the elbow, and where does the biceps attach? Right down at the medial compartment of the elbow, starts up in the shoulder. So the next step, of course, if we're trying to figure out elbow from shoulder, it's going to be diagnostics. Okay, so start with your fingers, start with your gut instinct and what you see on palpation, and then next let's reach for advanced diagnostics. So that's where we'll go from here.